Okay, well, welcome. I'd like to welcome everyone to St. Peter's University Hospital, our annual public meeting. This is, if you don't know the background of this, I don't know how many years ago, but a law was actually passed in the state of New Jersey that requires hospitals to have public meetings, to have a public meeting annually. And so that's what this meeting is. Actually, part of the requirement is that we have this meeting within a certain period of time after we complete our annual financial statements, audited financial statements. I think that we're required to have this meeting some 60 plus days or so afterwards. So normally we have the meeting at this time of the year because we file our financials generally in April. So we have it. And to be frank, a lot of hospitals see this as a terrible obligation, and they do as much as they can to try not to have anybody show up. Put it in the fine print of public announcements, and we actually advertise the meeting, more so in a more thoughtful or honest way, more authentic way, and actually hope that we'll get more participation. So, but that's what this meeting is about today. We are meeting a requirement, but it's also an opportunity to share with you, where we are and the past year. So at this point, though, make sure I've got a handle here. We're going to have a reflection, but for some of you, this might be good news that it's not going to be Jim. I'm only kidding. I'm only kidding. But I am going to call on Monsignor John Fell, who's the Episcopal Vicar for Healthcare Services for the Diocese of Metuchen, but also someone who we're very fond of, who's part of the St. Peter's family and has been on the board for many, many years, our Board of Governors, for plus or minus the last 30 years. I know he doesn't like me to say that, but in any event, Monsignor, welcome. We're happy to have you pray for us today and be with us. Thank you.
Thank you so much. Everybody, so good to be with you. Again, I'm always so proud to be connected with St. Peter's. Yeah, I'm the thing that showed up like 30-some years ago. It just hasn't gone away yet. It's great to be with you, as always. Bishop Cecchio asked me to mention how proud he always is of the work of St. Peter's. And and sometimes I think we say that the work of St. Peter's, the global entity, but he's very aware, and we all are, of that global work is because of people like yourselves and your staffs and the community we're situated in. So thank you so much for that. With that, how about if we pray? Heavenly Father, we thank you for all your many blessings. As we come together this afternoon, we thank you in a very special way for the gift that St. Peter's and all its employees and staff and administration, all of its outreaches bring to our New Brunswick community and beyond. We speak always about, Lord Heavenly Father, about how you love your people, you care for them. And St. Peter's is a particular instantiation of that. We thank you for the role that we have in making sure that we are good representatives of your love, your goodness, your care. We ask you to continue to inspire our efforts to bless the New Brunswick community and beyond in so many ways, but especially always through St. Peter's and the assistance we bring them. Lord, we ask you to send your Spirit among us to guide us in all the work that we do here, all the outreach that we do here. We ask you to keep us conformed to your will, to make us exemplars of your grace and your goodness, to make sure that St. Peter's and all of us are always blessings in the New Brunswick community and beyond. We make these prayers for you who live and reign forever and ever. Amen. But thanks and welcome.
Thank you, Monsignor Fell. Before I move on, I would like to acknowledge that, let's see, we are on here, that we do have several members of our Board of Governors here. One of the other things in the state regulations is they ask that board members also attend the annual public meeting. So we're happy to have them here today. And actually, I also am honored to serve as a member of our Board of Governors and Board of Trustees as an ex officio member. The CEO is also a board member. I want to recognize Linda Candia here, who's in the front. David Samuel just had to step out. He was here a minute ago. I want to in the back of the room. You can't get any further away.
We learned this in medical school.
I want to recognize to my left, Dr. Maureen Cernadas, who is a longtime member of our medical staff, is also our medical staff president, and is, by virtue of the fact that she is the medical staff president, is also a member of our governing board and board of trustees. And also sitting next to her is Dr. Christopher Ribbon, who is also a member, is the immediate past president of St. Peter's medical staff, and as a result of that, he is also an ex officio member of our board. So doctors, welcome, and also leaders on our medical staff. So I think I've got everyone, and of course Monsignor Fell, who I mentioned, is also a member of our board for a good number of years, and is the bishop's delegate representative on our board formally. So let's let us move forward. I have a number of slides I'm going to take you through. First of all, I'd like to start with our mission. Everybody knows that St. Peter's is a Catholic hospital. We're one of the few remaining Catholic hospitals in the state. I'm not going to read this to you, but just in terms of a bit of an overview, we obviously follow the teachings of the Roman Catholic Church, all of the Catholic moral traditions. We minister to the whole person, body, and spirit, preserving the dignity and sacredness of each life. And we are witnesses to the highest ethical and moral principles in pursuit of excellence in our community. And we have a focus on those who are more, than we say sometimes, most vulnerable among us, those that are not as fortunate. We are unique in our mission, not just because we're a Catholic hospital, but our sponsorship, our ecclesiastical sponsorship, our relationship is with the diocese. Technically, our ecclesiastical sponsorship as a Catholic institution comes from our bishop, the Most Reverend James F. Checchio, who's the Bishop of Metuchen, who just recently, it's hard to believe, celebrated his 8th year here in Metuchen. And St. Peter's is also unique in that it does have the sponsorship of a bishop, in that many Catholic hospitals were founded by women religious, communities of nuns, and really only a handful in the country are actually sponsored by a diocese and their bishop. So we are unique in that respect, also still operating as an independent hospital as we speak today. Just a little bit about who we are in terms of St. Peter's. We are anchored by St. Peter's University Hospital. So we are St. Peter's healthcare system. We are a one-hospital healthcare system with a number of ambulatory sites. We're one of the few remaining single hospital health systems in the state. Some of you have heard me say that before. There's literally only a handful left. There are 71 hospitals, acute care hospitals in the state, and there's only about 5 that are single hospital systems that have not joined with a larger entity yet, although we're in the process of doing so. I'll comment on that. A little bit by the numbers, we've got about 1,100 community and employed physicians, workforce full and part-time, per diem, got 3,800 employees. You'll see some of the other slides with statistics where we have about 23,000 inpatients or patients that are in beds. Our adult and pediatric emergency room are pushing back up to where we were pre-COVID at 68,000. We are one of the busiest maternity centers in the state, and last year had over 5,600 deliveries. I'm going to talk about in a little while our family health center located at Howe Lane, where last year we had 63,500 visits, and this year we're on track to have probably at least 5,000 more visits there. St. Peter's as a not-for-profit organized as a 501c3 organization. That's our corporate structure. We are tax exempt as a not-for-profit organization. And what drives our tax exemption is the community benefit that we provide. We provide a lot of free care, a lot of care that is provided below the level of reimbursement for government programs, Medicare and Medicaid. And then just, you'll see as we go through the presentation, so much of what we do in the community in terms of our outreach that is not directly reimbursed is all community benefit. And that's why we have the tax exempt status that we have. We're now over $600 million, but in 2023, our annual revenues were $583 million. So as a single hospital health system, we're pretty substantial. We're not the largest in the state of single hospital systems, certainly compared to those systems that have 10, 15 hospitals. We're a fraction of their size economically, and that's driving us in a different way that I'll share in a bit. A little bit more of the numbers. This is for year-end 23 versus 22. We really had a unusually good year in 2022 as we were coming out of COVID. And I don't know that St. Peter's ever had an 8.5% margin, because historically we've had our head above water or below sometimes, although we haven't been below water in quite some time. But in 2023, we more or less got back to a more normal level of about 3% operating margin. To sustain yourself, you really need a 3, 4, 5% margin. Margin for not-for-profit hospitals is the bottom line, and you may think of that in terms of profit. But we refer to it as margin because that's what it is. We need a little bit more coming in than is going out. We're not for-profit, so we're not owned. Nobody splits the profits. If we have more money coming in than goes out, then that allows us to support ourselves with equipment, technology, salaries, benefits, putting something away for a rainy day, because when you least expect it, it will rain. And so you have to always be ready for that. We've got 183 days of cash on hand. What that means, for those of you that don't know that term, is if no money was coming into St. Peter's because of some interruption in our revenue flow. Recently there was a major breach nationally that interrupted revenue flow in hospitals. I remember during Hurricane Katrina when I was in New Orleans, revenue was interrupted. So what that means is, in days of cash on hand, that means we could operate for 183 days before we would run out of cash without any money coming in. That's what that means. And that level puts us about in the middle of the pack, maybe above the middle compared to hospitals and systems in New Jersey. Days in accounts receivable, we collect on average about 39 days. And payables is our average period for payables, about 80. It's a little bit below average in the industry. But by and large, the good news is we're stable. We're in the strongest position we've been financially, perhaps in our history, if you look at our overall situation. Good news, this chart actually, when I look at this chart, what it means to me is it shows how vibrant we are as an organization. It also shows that we are continuing to grow in our services. If you look at the top two lines between admissions and medical observations, these are patients. Admissions, obviously, a patient gets admitted, they're in a bed. Medical observations are patients that come in that end up in a bed, but we don't consider them admissions anymore. And that's really been driven by insurers and payers that have categorized less acute, what would have otherwise been less acute admissions as medical observation. They end up in a bed. If you had an inpatient and a medical observation patient next to one another, you wouldn't be able to tell the difference because they're patients in a bed. But for payment purposes, the medical observation patient is considered an outpatient, even though they're in a bed. So I'll just leave that at that. But if you look at the combined total year over year, we're actually up higher. You can see that we're continuing to grow. And then the rest of these metrics, be it surgery, same-day medicals, emergency, volume, total surgical procedures, births. And the birth rate in this area is really not growing, but we are growing. The birth rate in New Jersey is not growing. New physician visits and consultations growing, and the family health center. We're actually, this year, we're budgeted for 70,000 visits. I'll come back to the family health center, but this gives a sense when you look at this. We may be a single hospital health system, but we're a busy place. There's a lot going on here every day, especially those of you that are in the areas of the hospital dealing with patients directly, wherever that might be. So let's talk a little bit about our future. We have spent the last several years planning for our future at an enterprise level. We refer to that process as a discernment process. And discernment is sometimes used in Catholic organizations for mission-based decision-making. You would hope that any organization that's thinking about its future and planning would think about itself from the standpoint of its mission. But we purposely use that word in Catholic healthcare. St. Peter's is in its 117th year. I mentioned that we're one of the few remaining independent or single hospital health systems. We are strong clinically and financially and in the mission that we provide in the community. But our industry has consolidated dramatically. It's gone through tremendous change. I remember when I first started, there were literally about 120 different hospitals in the state, all unique individual hospitals. Catholic hospitals, teaching hospitals, community hospitals, hospitals in urban inner city areas, hospitals in suburban areas, even some that were in more rural areas in New Jersey, although there's a few of those. Well, 120 plus became 71. And today, of that 71, I mentioned there are about 5 that are single hospital health systems. There's 3 systems in the state, Hackensack, RWJ, and Atlantic, that between them have, I think, over 35 hospitals, half of that total in the state. And so for us, our discernment process has been to evaluate, without too long a story, but has been to evaluate, can St. Peter's stand on its own, both economically and be able to carry on its mission well into the future. And the decision that our board made, and in conjunction with Bishop Checchio, was that really we could stand alone for a good while, but there was a question about whether we would continue to strengthen, become stronger, or over time would we grow weaker just because of the marketplace. And so our determination was, based on the best look that we could have into the future, was that even though we put ourselves in the strongest position that we've been in our history, the likelihood of continuing to incrementally and really substantially improve that versus the risk of potentially slipping backwards, that the risk of slipping backwards was greater than really being able to continue to advance on our own. And why is that? Is because we just don't have that economic scale. So we've been through a very extensive process. Some of you know that we had a process that the Federal Trade Commission ended up blocking in our initial decisions to merge. And now we're on the verge of joining with the Atlantic Health System based in Morris County. And we believe that that will be an excellent relationship for us, that our cultures align, and that we have a very good chance of, better than a very good chance, hopefully, of regulatory approval. So we're in that process. We're moving toward a definitive agreement. We announced the letter of intent back in January, many of you may remember. And I expect that you'll hear more about this in the near future, very soon. So that's at an enterprise level, our strategic direction. And at the very core of this is the fact that we'll be able to maintain and continue our Catholic mission and who we are, what we're about, and be able to carry that in perpetuity. As long as there's a hospital needed here in New Brunswick, in this site, it'll be a Catholic hospital. And it'll be under the ecclesiastical sponsorship of the Bishop of Kentucky. Now, as I said earlier, our bishop, Most Reverend James F. Cecchio. So more to come, stay tuned. There's a lot going on there. You know, hospitals just love all their quality accolades. But we are also very proud of all the things that we have accomplished. We never for a moment, think that we're entitled to declare victory and that we don't have to continue to work hard, because this is an everyday aspiration and work that must be done. But there's a lot of recognitions that we have in the upper left-hand corner. We are one of less than 20 hospitals in the country that have achieved 6 consecutive magnet designations, and we're working on our 7th. For those of you that don't know, magnet is what I refer to as the gold standard in nursing practice, nationally and really in the world, because magnet goes beyond the borders of the United States. And we're working on our 7th one right now, right, Linda? And there's other accolades up here. The Beacon Award recognizes neonatal and pediatric ICUs, or cardiac progressive care unit excellence in critical care nursing. And again, I'll just leave this up for a moment. You can take a look at it. There's just a lot of recognitions. I'm going to mention some of them. We've recently achieved again an A for leapfrog for patient safety. This is a series of metrics that measure how effective we are in providing safe care. Again, I want to remind you, we're not perfect. This is always a work in progress. We're always working at it. And tomorrow, unexpectedly, could be a day where something unexpected happens. So again, we never take anything for granted here. But Leapfrog has many metrics. Among them, some of the key metrics are just, for example, monitoring infection rates, various kinds of infections, surgical site infections, other quality metrics. Are patients safe in our care? Do patients fall here and get hurt more than they do in other hospitals? I mean, you want that to be a 0. You want all of these to be a 0. But the fact is, hospitals are very complicated, and so we're always dealing with that in a very intentional way. We've also recently received a 5-star rating from Health Grades, another national organization for patient safety. We've been named in Newsweek's list of some of America's best hospitals, and so that's another one that we're very proud of. We've also been recognized among America's best maternity hospitals. And again, these are not things that we apply for. We are recognized based on the publicly reported metrics and what's in the public domain. We are, as I mentioned before, a destination for, as a maternity center. We go all the way from the highest of risk to those that want to have a home-like birthing experience in the Mary V. O'Shea Birth Center, which is the only hospital, the only birth center licensed by the state of New Jersey, located on the premise of a hospital. And it's here, literally, with access, to its own entrance. But yet it's in a building on the ground floor that, if God forbid other services are needed, we have more complex services right upstairs in the maternity center. So, again, another unique program here at St. Peter's. We also meet the standards of accreditation. Again, I'm not going to read this all to you, but we've been accredited now through 2026 by the Commission for the Accreditation of Birth Centers nationally. And, again, we're recognized as a leader, something we're very, very proud of. And we have one of the most extensive midwifery programs in the state, certainly based at a hospital. And again, this is, for all comers. We do provide these services also at our the Women's Center over at our Family Health Center. And so, just a lot going on here. We also are Care Surgery Center, which is a joint venture with physician investors located in the CARES building has been recognized now 3 years in a row among the tops in the nation. One year we were #1 in New Jersey, and been in the top 15 nationally, and even higher a few years ago. So again, this is all based on publicly available data by Newsweek. So again, a lot of positives. Our diabetes center, which has been in place for I think over 30 or 35 years, or if not more, was also recognized by the American Diabetes Association, and gives you an idea. In fact, we have one of the largest programs in any hospital in the state in terms of our team of endocrinologists and nutritionists and support staff. We've also been very active in terms of our growth and development. So even though I mentioned that at an enterprise level we're moving forward to join a larger health system, we're also constantly growing and building, recruiting new physicians. So I'll give you a couple of examples here. This is Dr. Michael Guardi, who's a urogynecologist, and we recruited him as the chair of the Department of Obstetrics and Gynecology. And so besides being the administrative leader for the physician administrative leader for the Department of OBGYN, he's also a practicing urogynecologist, specializing, as it says, in pelvic floor reconstruction, and is actually also building that practice here at St. Peter's, besides being the chair of OBGYN. We also have our Gianna Center, and the Gianna program offers a unique approach to infertility within a Catholic hospital. Very few Catholic hospitals have this service, let alone any hospital. We recently recruited Dr. Monica Patashi, and she is leading this program now, and as it says here, it's a unique, restorative, and scientifically based approach to infertility and other women's healthcare issues known as naprotechnology. And so again, this is something different offered in Catholic hospitals where we can provide a service to address infertility that's consistent with the ethical and religious directives for Catholic healthcare services. Again, a very unique service in any hospital. Certainly, not every Catholic hospital by any means has this program, so we're fortunate to recruit Dr. Patashi to come here. Also, we've recruited Dr. John Perrone, who's a surgical resident here, and we had an active bariatric program, and the physician relocated to another state based on his family needs, and so Dr. Perrone is here and rebuilding starting to build a very active bariatric program. And also below this year, we also reintroduced thoracic services here, thoracic surgery services. Again, pretty acute surgical service there. Building, facilities here are always a challenge. This picture doesn't really, give the best indication, but what you're seeing here was a ceremony, an event, blessing up on the 4th floor. Yeah, and I have to talk to Michael. Michael, it's a little too close. A little too much of a close-up there. But what we were doing is, and you can see over here, where Deacon Vinny, who heads up pastoral care, in Catholic hospitals, it's very typical where you have a new facility, and instead of just celebrating it the way we celebrate it, it's literally a formal blessing. And we literally bless the facility. And so what you can't see is where we've built 10 new exam rooms up on the 4th floor of the medical office building to help with the growing need for clinical space that we have. So that's what you see there. This picture is over in the Family Health Center. So many of you are aware that we've recently completed a $12 million expansion of the Family Health Center located at L.A., 123 L.A. And so this is Bishop Cecchio, again, Deacon Vinny. This is a facility that's over 60,000 square feet. So after we had a gathering that I have a picture that you'll see in a moment, Bishop and some of us went out around all of the facilities, blessing the facilities. Over here, this was done with the great support in the middle next to Bishop Cecchio is Assembly Speaker Craig Coughlin. And Speaker Coughlin, to his left is Mayor Cahill. Mayor Cahill's left in the rear is Senator Robert Smith, and then in front of him is now Assemblyman Kevin Egan, and also, other supporters. Anthony DeMarco in the front there is a board member on our foundation, and on the left, Pastor Buster Soares, who really played a pivotal role in St. Peter's acquiring that facility many years ago. This facility, there's no place at St. Peter's where our mission is more embodied in what we do than in the Family Health Center. We're going to talk a little bit more about that as we go forward, but it's just absolutely fantastic, and it's been a wonderful team effort that's been led by, in large part, by Dr. Alma Ratcliffe here on the end, who's really done a phenomenal job leading the team there. We just did a big part of what we're doing here is addressing social determinants of health, which I'll come to a little bit more. What you see here on the right is the market at the Family Health Center. And what the market is for is to provide nutritious food and other staples of daily living to those in the community that don't have the means to do it on their own financially. Also, it's in a way food by prescription. We understand the needs of the people that come in, their health needs. We're able to provide a nutritional diet, so to speak, for them in terms of the foods that they ought to have, and they can avail themselves of that in the market. And again, it's not just a market to provide food. As Alma points out, our entire program at the Family Health Center is to help people not only be healthier, but be healthier because they're also productive members of society and how we're helping them evolve and grow and their families. So it's more than just about taking care of food. It's really a much more comprehensive situation. Here, what we did is we cut a ribbon last week. The gentleman next to me is from the Robert Wood Johnson Foundation. The Robert Wood Johnson Foundation funded $875,000 to help us build that market at the Family Health Center. I wish I had a before and after picture there, because before it was that space in there was a real train wreck in terms of if you saw that now. So you can see the market at St. Peter's. It's a service of St. Peter's Family Health Center. And you can see on top some of the narrative about what's there. This is, again, not everybody has something like this. We're not the only one that does this, but it's certainly, whatever the percentage is, I can't imagine that more than 10, 15, 20%, if even that, are doing something along the lines for their communities like we are here. Urgent care. Last year, just changing course a little bit here, we implemented a virtual urgent care service. You can see, the kinds of conditions being treated, open during the week and on Saturday and Sunday. And this is to help those access care rather than going to the emergency room and try to keep people out of the emergency room. They don't need to be there. We're also focused very heavily on our cancer initiative. In this picture over here, we recently implemented a new MRI. Some of you may recall we had a trailer outside and where we had a temporary MRI. So we're also partnering with Estera Cancer Care, which is an oncology group, the largest private oncology group in central New Jersey. And they provide the services for our radiation oncology. If we walked over to radiation oncology right now, you would see that we are under construction in the radiation oncology department, and we expect a new linear accelerator, state-of-the-art linear accelerator, that will be coming in the fall of 2024. So a lot of work going on. You know, cancer is mostly provided locally. Certainly I take nothing away from the major cancer centers, whether they're in New Jersey or around the country. The fact is most cancers are treated locally. It's a community-based disease, and they are treated generally locally, and unless you really have something, you know, that's more of the, you know, esoteric or rare, most cancers can be treated locally in community cancer centers. And then, of course, you know, where you need to align with a larger center to do. So a lot going on in the cancer services. We are working on also a project to expand our intensive care unit and totally rebuild it and modernize it. Those of you that are familiar with the hospital, when you come out on the 5th floor, you're going to be right in the intensive care unit. It's about a $30 million project, and it will, you know, we'll start making dust up there probably later this year. We're also going to be building a new pediatric intensive care unit. We're grateful that we were able to get a $10 million appropriation last year from the state budget, and we will be building that. I do want to mention back on the adult ICU that it's going to be named for Elizabeth and Joseph DeMarco. I mentioned Anthony DeMarco, that's his mom and dad, and they were very, very involved, especially his dad with St. Peter's for many, many years, and they've made a significant gift of $1.5 million to that project, and it will be named for them. Again, we'll be expanding from 8 to 14 beds on the pediatric intensive care unit. We have one of the busiest pediatric intensive care units of any children's facility in the state of New Jersey. So very, very, very busy. In fact, sometimes we get up over 20 and overflow. So a lot going on there. We've also expanded primary care, GI, gastroenterology, and midwifery services in Lakewood. So that's more growth that's going on, and a lot of patients come up from Lakewood here to St. Peter's. Also last year we opened up in Hoboken, at the CarePoint Hospital in Hoboken, a new multi-specialty children's clinic, or multi-specialty clinic for children on the premise of the CarePoint Hospital in Hoboken. It was named for Dr. Bipin Patel, former chair of pediatrics who passed away now going on 2 years ago. You know, St. Peter's is a regional referral center for pediatrics, and our children's hospital has between 500 and 600 transfers annually in from other hospitals in the region. And, you know, so a lot of children are referred here for higher levels of care. This was, you know, just honoring a couple of our physicians. This is Dr. Patel, rest his soul. We did name the women, or the Dr. Bipin Patel Pavilion outside facing Easton Avenue in honor of Dr. Patel, who was here for 40 years and really built our children's programs, and we really have him largely to thank for his leadership for what we have here today. So we did honor him last winter. I remember it was cold that day, right? So it was in the winter, and we honored him. We also recently, if you're familiar with our simulation center, someone else who's been here even longer than Dr. Patel was, Dr. Nayan Katari, who's our emeritus chair of medicine, named the simulation center in Dr. Katari's honor, as that was solely his vision, you know, to have here at St. Peter's. St. Peter's, it's important that we also are thought leaders. We did have a program here recently with Mayor Cahill, where he was interviewed and talked about a lot what's going on in the city of New Brunswick, all the growth and development. We also hosted an event with Congressman Pallone on drug pricing and a lot of the work the Congressman has done. He's our Congressman and is very supportive of St. Peter's. Community health, a lot going on in community health, or whether it's our mobile van, the other things that we do. Some of the numbers are up here in terms of the individuals that we've seen, 228 different sites, senior centers, libraries. This is part of that community benefit that I mentioned before. We are present in the Monroe Adult Community Centers that we staff. Flu vaccines, were administered at 67 different sites. So we're very active out in the community. Although now that this has subsided, we played a very active role during the COVID-19 pandemic. We've administered through 23 over 45,000 vaccines. And this room, when we were doing that, was also our vaccination center. So a lot going on there. You can see the numbers, over 120 COVID clinics that we had, and just a lot going on. Although, things have changed as far as the vaccine is concerned in terms of people wanting it, taking it, but we do remember a very, very active effort there. Again, here, just some more information on COVID. We had state-funded grants, and fortunately, we were able to provide a tremendous amount of community service. So I mentioned social determinants of health. And one of the things that we have done with our colleagues at Robert Wood Johnson University Hospital, we have worked for years collaboratively to benefit the community. In fact, we were on a run there several years ago where, every year, maybe there were 3 out of 5 years where among the hospitals in the state, we were recognized by the New Jersey Hospital Association at its annual meeting for having the most impactful community outreach initiatives. So we also work with Healthier Middlesex, which St. Peter's and Robert Wood Johnson University Hospital anchor. But as it says there, it's a consortium of over 60 different community partners who meet regularly. And you can see here's the brand mark, so to speak. Hospitals are required by law to perform annual community surveys, or actually community surveys. I think we do them every 2 years, if I'm not mistaken. But we take a very active role. And if you look at our focus, and when we talk about social determinants of health, these are the kinds of things that we are focused on. And we've done very, very extensive surveying with our community health improvement plan, that you can see here. Access to care is important, technology, mental health, financial insecurity, housing. St. Peter's supports programs in the community to help reduce housing. You may recall an article where we gave the city a grant to help address issues of homelessness. You see food insecurity is there. All of this relates to, these are the social determinants that will impact people's well-being. Do they have a job? When you talk about financial insecurity, are they housed properly? So a lot going on there. We have a process for surveying the community. Again, I share this, I'm not going to read the slide through, but it gives you an idea. And a lot of education going on. Again, I mentioned that community benefit before. And part of what we do is just the education and outreach to the community that, it's what we do as a benefit. It's not that we're being paid for it or that we're charging for it. So again, a lot going on there. Again, more information about, the work that we are doing. And it's important work because ultimately we're here to serve the community. Again, more information about our focus on diversity. And as a Catholic hospital, it's amazing. We celebrate various cultures and ethnic groups, different racial group, whether it's Black History Month, Hispanic Heritage Month. I've never been to a hospital that celebrated Sukkot with a Jewish holiday, let alone in a Catholic hospital. You know, so Diwali, Hanukkah, Martin Luther King Day. It was just, I don't know, maybe some people might say that at St. Peter's, you know, we always are looking for something to celebrate and have a little party. We like to celebrate, but you know, this gives you an idea of some of the things that go on right in this very room, and our focus on people, the differences in people, and the communities that we serve, because we are in Middlesex. I don't know that there's a more diverse county than Middlesex. This was a very special day, several weeks after the events that occurred in Israel on October 7th, where we had a interfaith prayer service here with, you see Monsignor Fellas in the picture, and Rabbi and Imam, and you know, you see the room was pretty crowded that day. It was quite a moving experience that we had here. We're all over social media. It's easy to find St. Peter's, thanks to our marketing and communications team, so you know, we share that with you. And that's a great shot of St. Peter's that Michael Castronova took. So with that, I'm going to stop there. Hopefully that gives you an idea about, you know, where we are, what we're doing, you know, what our future looks like a bit, and all the various activities underway here at St. Peter's. It's a lot of information to absorb, and I want to thank Michelle and Lisa, our marketing team, for their work in pulling all of this together. And I get to present it, and you know, they did the hard work really of pulling it all together. So thank you. So anyway, we do have cookies, coffee, and some refreshments. But before we get to that, I'm going to open it up for questions. Anyone might have questions. Anyone? Yes, sir. Speak up so I can hear you, because with this HVAC, it gets a little difficult.
Thank you very much. Mr. Hirsch, members of the board, my name is Charlie Cradaville. I'm the editor of New Brunswick Today, community newspaper, available online at newbrunswicktoday.com. I want to start by saying thank you for the presentation. I found it really informative and enjoyed it. I did want to ask about the plans to merge with Robert Wood, and obviously you mentioned they were scuttled, and now there's a new plan. I wanted to ask if you could reflect on that, if there's any lessons learned or things that you think bode well for this new arrangement based on that, and I do have some more questions.
Sure, yeah. Well, first of all, the federal government, you know, through the Federal Trade Commission, the way it works is that there's a federal review and a state review. The Attorney General's office in New Jersey, under a law called the Community Healthcare Assets Protection Act, CHAPA, abbreviated. The state Attorney General's office reviews these kinds of transactions really on the basis of community benefit. So they look at it. I'm grossly oversimplifying it because it's a very, very in-depth process. As we go through this now, we did it the last time. By the time we're done, easily there'll probably be 10 to 20,000 pages of documents that are reviewed. But they're looking at it really to be sure that the change of control is in the community's best interest. So they look at it that way. The federal government, on the other hand, they look at a transaction like that and they make a determination as to whether they believe it's anti-competitive. And so, again, I'm not an expert, and I'm going to hit the glass ceiling here pretty quickly, but they have pretty detailed economic models that they follow, and they'll look at a county generally, and they'll predict, you know, or they'll look at market shares, and they'll come to a conclusion about whether or not they think that the transaction is anti-competitive. That's what they came to the conclusion with in the case of what we had proposed with Robert Wood, Barnabas Health. Now, of course, we thought that at the time that it would be, in the community's best interest because of what we were trying to accomplish. It was something that was very focused on the community, and we believed it would actually create something that didn't exist in New Jersey, really a premier academic medical center that would be based on multiple campuses there and here. The federal government saw it differently. We decided not to pursue litigation and moved on. And so in this situation now, fast forwarding, Atlantic Health represents a wonderful opportunity for St. Peter's. They too are an excellent organization. They're a highly respected, high quality organization. While they're not a faith-based hospital, our cultures are very similar. From the standpoint of the regulatory review, the state of New Jersey will do the same thing. We'll have to make the filing, and they'll ask us many questions, and ultimately they will look at it to say, is this in the community benefit, community's best interest for a change of control? Because that will be a merger. We would merge in with them, and so they'll become the sole corporate member of St. Peter's, and Bishop Cecchio will continue with the ecclesiastical sponsorship because we will be a Catholic hospital, and that's the most important thing that we accomplish here. But what we believe is different in this case, in this instance, compared to before, is that the marketplace is very different. They're based up in Morris County. Their closest hospital to us is in Union County. They have one in Morris County in Morristown. They have one in Summit, that's Union County. And then they're further west. They do have an affiliation, a very close affiliation with Central State that is part of also with Atlantic. So when we look at this from the standpoint of the market, God bless you, whoever sneezed. When we look at it from the standpoint of the market, we see a much different picture. So we believe that we have an excellent chance that the federal government will see this in a very different way than they looked at, through the filter of how they looked at the last project. So we're very optimistic and hopeful.
Thanks, understood. And just to follow up on the slides, I saw a mention of January 2025 as a target date. Was that correct?
From the time that we signed a definitive agreement, it could take as long as 18 months. I think 12 to 18 months is a reasonable window. So if, let's just say that, half of this year, and it could be any time between, say, a year from now, potentially 13 months from now, or maybe even 18 months. We know how long the CHAPA process generally takes, but really the wild card is, how our friends down in Washington are going to review this. I mean, it's very possible with Federal Trade Commission reviews that you could be, quote, in and out in 30 to 60 days if they decide not to dig deep. They dig deeper, then it could take that much longer, and that's why, the outside 18 months.
Thanks. I wanted to ask about the potential for campus growth in New Brunswick.
Sure.
Looking at the beautiful image up there, all the way to the right is the old Votech school, right?
Yeah.
I wanted to follow up on that because I know there were plans at one point to develop it.
There.
Yeah, what's the status on that, and any other kind of plans to expand?
Yeah. The Votech Center right now, we've done some pretty thoughtful facilities planning, because if you look at the rest of the campus, St. Peter's developed like a lot of hospitals developed after World War II, where additions were made on core facilities. So if you look at our facility, in the very center, kind of up here, in the center, you could see the old core that goes back to the 1920s. And then, other wings were put on. Certainly this one right here. This is 1960s vintage. This is 1990s. So we have older facilities. But one of the things that we've learned through our master facility planning is that the first thing that we probably ought to do, and that we should do in terms of when you think about over the course of 5, 10, 20 years, and the domino effect that happens as facilities are built. The VOTEC Center is the first place that ought to be developed. And so what we envision there is we do need more parking, for sure, but we also have the opportunity that if we build administrative space there, we could potentially relocate this conference center there. We could also take where we have administrative space in our medical office building and transform that to clinical space, so that we have needs for outpatient services. So that would be the first thing that likely happens, and that building would come down. Combination of parking, relocation of the conference and administrative space to free up to create clinical space in this building. So the space that we're sitting in right now could potentially become new clinical space with great access right to the outside. And so hopefully Sister Marie would not be upset with us if we relocate the conference center with her name and her name.
Just a couple more questions.
Sure.
Wanted to ask about the workforce and sort of what you're seeing in the industry. I know there was a big strike at Robert Wood Johnson last year. I'm curious if that impacted anything here or impacted the nursing here. And then I'm also interested in ambulance service and how various areas are getting, if areas are getting the service they need to be able to get folks to the ERs and stuff.
Yeah, well, I don't have any comment on the strike at Robert Wood. I will comment generally about the industry. One of the things that we saw from COVID is that it really exaggerated or exacerbated some situations that existed previously. What do I mean? So it's been well known that we've had shortage of nurses in this country, and when you look at the baby boom population, people retiring just in the normal course, and then not as many coming in. So God, I've been in healthcare over 40 years. I don't know how many nursing shortages I've lived through. But this one was different in that the situation with COVID had a stronger impact on people retiring, transitioning, being burned out. So it's been more of a challenge. Right now, what we see is that, not to say that the shortage is over, but things are stabilizing. We've got a much better flow of people coming in, being recruited. One of the things that happened, when you look at supply and demand, is that labor costs have gone up. Post-COVID labor costs have gone up substantially, not just in nursing, but all different position classifications. So that's one of the things we're experiencing. Definitely higher costs, putting pressure on operating margins. Again, we're not for profit, but we need more coming in than goes out. And so we see that supply costs going up. But the other thing that we also are grappling with that is at an all-time, I'll just say all-time high, not in a positive way, is what our experience is in dealing with commercial insurers. And that's getting paid for the services that we provide. The rate of denials, downgrades, not getting paid is a real problem in this state and nationally in terms of the practices that we're dealing with where we provide a service. We're about the only place that provides a service and isn't guaranteed that we're going to be paid for it. First of all, by law, we provide service for people if they have no insurance. They come to the emergency department, they need services beyond that, we provide it, whether they can pay or not. But there are people that are covered by health insurance that we don't get paid for, and that's because of the issues that we deal with payers. And this has become a national problem. It's very well known. It's not unique just to St. Peter. So that's really accelerated in the post-COVID environment too. So I hope that provides a little bit of insight on those issues.
Yeah, and the last thing, I just wanted to make a comment and ask a question. The things I think facing this population in New Brunswick that healthcare systems need to keep in mind are unfortunately violent crime, mental health, and also the climate crisis. And
Which
the climate crisis. So obviously we have more days with air that's hard to breathe, extreme storms and flooding, things like that. And so, obviously you can respond to whatever you like, but I was hoping to hear from you about climate change and sustainability, what the hospital's doing for that.
Yeah, no, we're very active. In fact, if you look at St. Peter's, we're one of the most energy efficient hospitals in the state. If you look at, we have a cogeneration center. We've got, if you look, we have more of the cellular panels that most places have. So we're very environmentally conscious. And if you look at our utility costs, not even aging them for inflation or adjusting for inflation, our utility costs are actually cheaper today than they were 15 years ago. Garrick is really the expert on it. You may want to speak to him afterward, because we have done a phenomenal job here of optimizing that. And in fact, we have a project, $7 million project now that's underway. We've been able to partner with PSE&G, and we've gotten low-cost loans and grants that really ultimately are very, very positive for the environment, because our energy usage is very different than it was. And so it'll only get that much better, as we go forward. So I hope that gives you a little insight. Yeah, but thank you for your questions, and thank you for coming. Other questions? Anybody have anything else? Everybody wants the cookies and coffee. All right, well then let me just say thank you for coming, and we're happy to share all this information for our board members that came today. I want to extend a special thanks. And if there are no other questions, then we'll adjourn. All right, thank you.